Good afternoon, viewers at home, and you are welcome to Spring Clinic. Spring Clinic is where we diagnose and we prescribe treatment for all manner of ailment for the purpose of deepening your understanding of the medical practice and medicine as a feed. Today we have a big fish in the clinic on a visit. He's a consultant. Let me say that he's a professor of bones and plastic surgery. And apart from that, he's the chief medical director of UniOcean Teaching Hospital, Professor Peter OLAITAN. You're welcome on the program.
Good afternoon.
It's so good to see you.
Nice to be here.
So, to me as a layman, bones is just an injury to the skin. But to you as a professor of bones and plastic surgery, can you break it down? What does it mean when you say you have a bone?
Well, I think when we talk about bones, we talk about destruction. I mean, not just an injury, it destroys any part of the body that is burned, is destroyed. So we're talking about destruction of this, either the skin or the mucosa or any part of the body by extremes of heat. Okay, it could be flame, it could be fire, it could also be cold. So somebody can be burned from extreme of coldness or from extreme of heat.
Wow.
So there are quite a number of things that could cause that, but that's
a new one.
Yeah.
From extreme of coldness.
Yes.
I haven't had that before.
Yeah, it does happen because we are living in the tropical world.
Okay.
We don't see some of these things. I mean, if you are in winter, and then especially for the whole people in the Western world, they're in the house, there's winter, the house is not properly insulated, and so there's extreme cold, and they're just there, and they're shivering, and you find out that their blood vessel will constrict, and the skin overlying the blood vessels get destroyed. So extreme of cold can actually cause, or you put your hand in the freezer, for example, within minutes, that hand is going to, because there's not going to be blood supply.
It deadens the vessels.
Yeah, it deadens the vessels. It occludes the vessels. It prevents blood from flowing. And once blood is not flowing, metabolism doesn't take place. That part of the body is not getting food.
Wow.
And within a short period of time, it dies.
So any extreme weather condition will cause a burn.
Burns, yeah.
Okay. Now, let me ask this. Daily, we travel. I know burns do occur as a sort of accident or something like that. What should be the prescribed first aid that we should apply? When I was young, the first thing we did was to apply Ogi.
Yeah.
You know, local paps that you rub it on it before you get to the hospital, or palm oil or honey. But I'm not talking to a professor of bones and plastic surgery. What should we do as first aid?
I mean, that's a very good question. I mean, the first thing to do, because of course we have different types of bones, and that will determine what we should do first. For example, somebody is electrocuted, so you got to get him out of that. By all means, get him off the electrical connection by all means first, and then you can then put water on him. But of course, you don't do that while he's still connected to the source. And same thing you can do with somebody who has flame burn from fire, so extreme of cold. Water is the solution, and the water is not cold water, it's not hot water, it's not warm water, it's the normal room temperature water. So when you do that, you pour that on somebody who have heat, increase in temperature from fire, it cools the environment and stops the burning process. So in the immediate time. Of course, if it's extreme cold, it brings up the temperature. And then also normalizes the flow in that region, thereby preventing further destruction of the tissue. So that is what to do. Pour water and water and water. Nothing more. In this environment, we've seen people...
Room temperature water.
The normal water we drink from the pot or whatever, from the bottle that is not put in the fridge. And so it does two things. It stops the activity of burning. Two, it also reduces pain. So those two things are important. So now, unlike other things that people use raw egg, people use pap, people use palm oil, people use even sand, you know, all sorts of things that people use. Each of those things can cause infection of the wound.
I was going to that.
Because if you use egg, for example, you are just incubating, encouraging the growth of bacteria
around the bone.
Yeah, that's what one is doing. If you use palm oil contains bacteria that we cannot see.
Wow.
Of course, you are infecting. Any other thing you use, you are infecting that one.
Okay. So the water is the best thing to use.
Water at room temperature, just pour as much as possible, and then get whatever clothes he's wearing off him, and then get something neat, something dry, neat to cover the person before you take the person to the hospital.
How long does it take to treat burns? That the skin will regestate, if I can use that word, and come to normal, and come to the normal color. Again,
that brings what is the depth of the burn.
That's right.
Now, the American classify the depth of the burns into 4: first degree, second degree, third degree, and fourth degree. They describe the first degree as the surface, the thin surface on the skin being destroyed. And that could happen when you put iron accidentally on your hand. And you just see exfoliation in the next 2-3 days. Okay, that thin part has been destroyed. So that's first degree burn.
Okay, sir.
When you have second degree burn, it goes deeper than that. Okay, that can also reepithelialize and the skin becomes normal. Now, when it comes to third degree burns, fourth degree burn, the skin can never be normal. And that's the one people talk about. Okay, once a body is scarred, once it is scarred, it is scarred. There's nothing you can do. Once you have a full thickness injury, you cannot get it restored back unless you do some other things. But on its own, healing by its own self, you can get it back.
Let's educate our people. How many layers do we have in our skin?
Yeah, well, essentially we have like 3 layers. We have the epidermis, we have the dermis, and we have the subcutaneous tissue we call skin. Okay, that covers a lot of fascia, a lot of muscle underground. But when you talk about skin, usually we talk about epidermis and dermis.
But so the fourth bond grade.
The fourth bond grade will bond down
penetrate down
the subcutaneous tissue under the dermis and bond the muscle.
Wow.
Okay, once it's getting to the bone, then that's the fourth degree. Okay, and that's the worst of them. So if it burns the bone, you may need to actually do amputation in some time. Okay, so that's the way it is. So what you do and how long it takes to heal depends on the degree of the bone injury. First degree burn within 48-72 hours, the person may not even remember that he has a burn. Second degree, third degree, maybe within 2 weeks, there are about 3 weeks, there is reepithelialization. Epithelial cells that cover the skin comes on its own if it is not infected and just heal, and you may not be able to see the scar. But once you are going to third degree, fourth degree, it's going to be scarred, and that takes a long time, longer time, months sometimes. In fact, some people have carried wounds, burns and wound injury for years that is not healing. Okay, so there is the need for intervention at that point that will stop the process of wound.
Yes, you said that the first thing we should do if there's a case of burns is to pour water. After you pour water, before you transit to the hospital, can people cover up with bandage, with plaster?
You don't have to
leave the wound open.
Leave the wound, cover it with a normal cloth. Okay. So, for example, if it is burned on the trunk, for example, the chest, the abdomen, the back, then just let the person wear a cloth or wrap him up with a wrapper and then take him to the hospital. You don't need to apply anything because, again, at home, most of the things that are at home have bacteria that we don't see. So when you cover the body with all sorts of things like this, you're actually encouraging further infection of the wound, which is not good. Burn injury at the onset is sterile. It's not, it doesn't have any bacteria. But in the process of carrying, in the process of putting something or the other, we get it infected.
Well, you've spoken about bacteria, that we have it everywhere. What kind of environment should somebody that suffer burns live in? How hygienic, or what should he or she avoid?
I didn't get that.
I mean, if somebody suffers burn, for instance, and you are in your house, what kind of environment do you have to stay in? An air-conditioned, in a normal atmosphere? I mean, at very conditioned or what?
Well, normal room temperature. Again, of course, it depends on what amount of burns you have. Okay, we usually say that we also, as we describe burns in the depth of the burn, we also define it in the extent of the burn. The whole body is about 100%, and then the proportion of the body that is burned is also gauged. Now, we don't expect anybody with less than 10% injury to be admitted, you can treat that on an outpatient basis. But once the bond is getting to 15%, that person has to be admitted in the hospital and be taken care of. Okay, so if somebody has 1%, less than 1%, 2%, 3%, once it doesn't affect the bone, the joints, okay, it doesn't affect the face, it doesn't affect the perineum, and it's less than 8-10%, we can say, okay, dress it, go home and stay at home. It doesn't matter whether it is cold or warm environment, wherever he lives, for as long as it is covered and protected by sterile thing, it's good. But once it goes beyond that, it becomes a major bone, more than 15%, or a thickness of greater than 10%. If it's a full thickness bone injury that is more than 10%, or it's an injury that affects the joint of the hand, the joint of the elbow, the wrist, and the knees, because if you leave that to go home and it gets infected, it gets worse. It can move from second degree to fourth degree, and then it gets complicated. And every human being, once you are at rest, you want to, fold yourself. You want to be in a flex position. And so when that wound heals, because the person is not under the care of the doctor, it tends to contract. So you find people whose hands are contracted, the chest is contracted, the neck is contracted, and he can't move, he can't do anything. He can't do this again. So that's why we say once it affects the joint, come to the hospital. The hand is splintered, the axilla is splintered, and contracture is prevented. Okay, so once you have a major bone or you have bone involving those joints, just admit. Now there are also other bonds. Electrical bonds generally we want to admit because we want to observe and see, because again, somebody may have electrical bone injury, small it looks, but in the next 48 to 72 hours, you just see it extending. Wow. Because there is an entry point and there is an exit point. Between the entry and exit point, damages have been done that are not obvious when the patient comes in. That don't manifest at the beginning. So when you see the patient and it's small, you may want to say, oh, just go home. But because we know electrical injury, we just say, okay, get him admitted. Let's watch him over some hours, 2-3 days, and see if it's progressing, then we can manage. If it's not progressing, then we say, go. Chemical burn is another one. And people accidental chemical burns injury are things that happen in developed countries. But in our own world here, people assault one another. So one girlfriend has guilted somebody, and then just pour chemical on him. Now, any chemical injury we want to also admit, no matter how small it looks, because again, it also have the propensity for getting worse. Burns that are result of assault, burns that are result of suicide attempt, then we want to keep, because that's more than what you can just go. Somebody wants to kill himself, then you need psychiatrists to see him and work with him. Or somebody is assaulted, then you don't return that fellow to the environment where he was assaulted. That's right. So you also want to keep such people in there. So there are reasons why we keep patients in the hospital, even when they have small burns. But generally, when they have major burns, electrical burns, chemical burns, we want to keep them in the hospital.
Prof, our medical system is staggered in 3 stages: the primary, the secondary, and the tertiary level. When somebody suffers burns, can we approach the primary stage of to assess medical treatment, or you should go to tertiary where experts are available, or you want to say that there are experts across the board?
Not really. I mean, like every system, every of our care, the closest to every individual is the primary health care. So they should be able to offer some first aid. Okay, and they should be able to say, look, this is not what we can handle here. For example, somebody has escalated. Somebody has a small wound on his palm. You don't expect him to come to the teaching hospital. If he goes to the primary health care center and they dress it, oh, it's not so bad, we can manage you here, and they dress it, it could be fine. But once the burn is getting to major burns, burns involving joint, then that patient should be treated in a specialist care. Not in a secondary, not even in, except the secondary care has a burn unit or a burn expert that could manage that person. But it should, somebody like that should be treated in a burn unit where the experience will provide the best opportunity for that fellow to prevent complications.
But the experts within your bracket are more available at the tertiary level.
Yeah, they are. Today, I don't think there's a plastic surgeon in Nigeria that is.
I know. I was coming to that.
Yeah, so
I'm coming to plastic surgery.
So most of the time they are at the tertiary care centers. But then, like I said, it depends on how big the wound is, how deep the wound is. If it's not something so big, somebody has bone injury from iron, pressing iron, it may not even go to anywhere. Okay, so he could take care of that by himself.
Yes, sir. Dermatologists have spoken against skin bleaching, which is fashionable among some people for one reason or the other. I believe that it takes a measure of not having self-confidence to go on the route of skin bleaching, but it's what is in vogue. Is this skin-borne? Because we see some of them manifesting all manner of stuff after they were bleached for a long time. Is it what you can sort? Yeah,
it is not burns, okay, but it's also a form of destruction of the skin. You are removing melanin from the skin, especially when you have a lot of silver content in the chemicals they use in bleaching. So you're removing melanin. Melanin is protective. The fact that you and I are black is an advantage.
Wow.
Sun energy heats us.
Let them know.
Sun energy heats us, and the melanin is protecting us from skin cancer. That the white doesn't have.
That's right.
The quantity of melanin in this white is less than
what we have as blacks.
As black.
Wow.
And that's the kind of problem we have in albino. The albinos don't have enough of melanin, okay, being produced, and so they are like the whites, and so they tend to have skin cancers. So anybody who bleaches a skin is exposing that to himself to that. That's one. Two, when they have wound also, it doesn't heal well because the dermal part of their skin is thinned. Okay, and so the wound doesn't heal well, and apart from disfiguration that will happen later in life. So cancer, problem with wound healing are major issues with people who bleach, and that's why we advise, please, you don't need to.
I know most often you plastic surgeons do what we call skin grafting when you have serious cases. Tell me about that.
Yeah, what we do really is to, okay, there is a destruction of skin, and we know that this is not first degree or second degree, so it cannot replace itself, regenerate itself. So in order to prevent infection, because the skin on its own prevents infection, bacteria from coming in. Okay. And of course, it also prevents loss of fluid. So you need to minimize the loss. You need to minimize the infection by bacteria. So you need to cover with skin grafting. And that's why where we affect skin from the body, from one part of the body. For example, if the person has like 10% or even 20% of the body surface, we go to where the area part of the body that has not been burned, and we affect skin there, and the skin we affect contains epidermis and a little part of the dermis, so it can epithelize and grow on itself. Even in 2-3 weeks, you can still go back to the same site and affect and still put. So you can do skin grafting, take the skin from the person and use it to cover the wound. It makes it to heal faster. And it also prevents complications that could arise. So that's what we do. And there are so many ways you can get skin from the person, from donors, especially from zygote. Outside this country, you have cadaver skin. They affect the skin of the dead and store. So it can be used to cover the person, anybody who has burns.
And the body will react positively to that?
The good thing about it is that if you use, anybody who uses another person's skin, it's going to get rejected in 21 days. Okay, but within the first day and 21 days, it kind of provides an environment of protection and energizes healing. And so the wound heals better than if you never covered it with anything. Of course, there are also artificial skin that are very expensive now, being manufactured, and you can cover the body with the artificial skin, and that person is fine.
Another thing that is in vogue now is crazy amongst ladies wanting to introduce what they were not born with. Is within the purview of plastic surgeons, if I'm right, big boobs, bumps. How advisable are those extraneous addition to your body?
Well, you call it extraneous. We call it, fashion. Everybody has a right to his body, okay? And if you think that your image isn't good and you want to improve your image, we plastic surgeons encourage you and we assist you in doing that. It's not dangerous, okay? Somebody can ask some small. Let me start from this. There are people that actually have very small breasts that is putting men away, and they come to us and say, "Oh, I want this breast to be beefed up," and we try to do that.
To do silicone, or you enhance it.
We enhance it. It could be silicone. It could be even autogenous from the body. We remove something, we move something, some fat, and then we improve on that appearance. Or somebody's butt is not big enough, and it feels, oh, my friends or whoever is not happy with it, or I want to really have a big butt. And so we enhance that. Okay, absolutely, I don't think there's anything wrong.
We've seen some dangerous stuff on social media of some decaying bones, some decaying boobs, and decaying backside.
Yeah, we anything that is, I mean, anything can have its own side, low side, and I think that's just it. There's no surgery that is absolutely free of complications. Okay, so and that's why if you're going to do that, you need to do it with somebody who's an expert in the field, who has been doing it, and you've seen results. In this part of the world, in developing countries, I mean, there have been unfortunately some results, very terrible results, from people who are not supposed to do it in the first instance. There was a lady, a nurse officer, who just started a cosmetics procedure in Lagos, and the MDCN had to stop because there were issues coming up. So, but if people go to the real expert that do this every day, and I don't think it's a bad problem. I don't think there are complications. But like I said, there's no surgery that doesn't have its own complications that could arise, down up to death. Okay, but if you go to the proper person with the experience, then that person is safe.
We don't have many professors of plastic surgery around, or plastic surgeon. I don't think we have so many. Do we have the capacity in our university system to train and replicate as many as Professor Peter OLAITAN?
Well, I think we do. I mean, we do have some number, and the number is increasing every day. Okay. In Osun State today, we have at least 4 plastic surgeons.
And we have 4 million people.
That's a million. You're right. So we have 2 in Ife. We have my humble self here in Osogbo with another person. So we have 4 in Osun State. And of course, that's a very low number. But we have the capacity to produce. Of course, the Japanese syndrome is also not making things good for us, because our colleagues, our younger colleagues, are graduating and then just disappearing rather than staying at home and training. But by and large in the country, I think if we look at 10 years ago and what we have today, we have quite an increase in the number. We have up to 150 plastic surgeons in Nigeria today.
Wow. Let's go back to bonds now, which is the main focus of our conversation. Most people, for many reasons, poverty, ignorance, they patronize local people to treat their bonds. How advisable is that? And are you aware that this exists?
Yeah, I am aware. I mean, one is the local people who don't know anything about it. 2 is another group of people, doctors, physicians, nurses, who don't do this all the time. You know, I tell people that my nurse in my bond unit knows more about bond than any doctor that is not treating bonds every day. And that's the truth. So what you do every day, you get used to it. My advice would be that, look, don't go to people, especially when it is a big bond or it's not getting improved. Of course, some of our people talk so sweetly to the people, and people don't ignorantly just think that they are the correct thing. But I feel if you have a major bond that is more than, how do we calculate percentage? The palm of the hand is about 1% of the body surface. So if you think you put it on that skin and it's getting more than 8%, 10% of your, it's about 8 to 10 of your home palm, then you know that's a serious bond. Don't stay at the local place. Get to a bond center.
A bond center. Now, you told me earlier on that bonds occur as a result of excessive weather, heat, or coldness. Now, some of us love to have a warm bath. Some like it very cold. How advisable is that? To what can you help us moderate it? How warm should my water be, or how cold should my water be for my bath, so that I don't cause excessive damage or damage of whatever kind to my skin? Well,
I mean, it's about how much tolerance. I mean, we take hot tea, and it doesn't burn our throat. Okay, so it's just like whatever you can put on your skin and you don't feel too hot about it, or whatever you can drink and you don't feel too hot about it, is good enough for you. So I won't want to say this is the temperature. I mean, some people they like it hot, but for as long as it's not so hot as to cause and difference in the color or in the skin in your skin, then it's not a bad idea to use
cold bath or warm bath.
Now, one other thing I would like to say before I go here is that one of the most common burn is burn from fire, burn from domestic burn, from cooker, from stove, and that is something that we need to know. When you want to put, when light goes off and you want to put on your generator, you don't go there with your torchlight, your handset, and the handset rings. You don't pick that and say there have been explosions just from that. Trying to start generator and your handset, you are answering a call, it just explodes. So we need to be careful about that. We also need to be careful about you want to put on your lantern. The lantern, the kerosene gets off, totally off the lantern, and the lantern is on, and you don't want to pour kerosene into the lantern with the fire on. Explosion, and a lot of people have died from that also. And also we advise that if you want to, you build your house, you want to put gas cylinder, don't put the gas cylinder in your kitchen, put it outside
the kitchen,
pipe it inside. Okay, so if there's an explosion of that cylinder, it's going to be outside and not in your house. So those little things are important. And I also advise people to put fire extinguishers in their kitchens. That also helps, so that you know how to operate it if there's any case.
Okay, sir. Thank you very much. We'll continue after this break.
Thank you.
Various issues that we're interrogating today at the Spring Clinic are issues around bones and plastic surgery. And my guest has been Professor Peter OLAITAN, a professor of bones and plastic surgery. Don't go anywhere. After this break, we will continue on measures to sensitize and, of course, to galvanize people around issues around bones and plastic surgery. Stay.
Olayinka Herbert Macaulay, politician, nationalist and journalist, was the first Nigerian to qualify as a civil engineer, surveyor and architect. Born on November 14, 1864, Herbert Macaulay was the founder of Nigeria's National Democratic Party, the first political party in pre-independent Nigeria. Scholars of Nigeria's political history describe Herbert Macaulay as the intellectual bulldog of 19th century Nigerian nationalist movement, in deference to his qualities as founder and leader of two foremost political parties, Nigeria National Democratic Party (NNDP) and the National Council of Nigerian Citizens (NCNC). His matchless versatility in party organization and control kept the British colonialists on their toes in the entire span of his active life. After his death on 7th May 1946, Herbert Macaulay remains a hero of his country, which recognized his anti-colonial struggles. Today, Nigeria's 10 naira coin bears his oval face and trademark moustache. Western Spring Television identifies Herbert Macaulay as a major character in history. Ahmadu Bello, a Prince Royal, was born 6th of December 1910 at Raba Village, Sokoto, northwestern Nigeria. His father was a district head and heir apparent to the Sultanate throne from the house of Usmanu Danfodio, a religious and social reformer who brought the Habib dynasty under the Fulani Caliphate in the beginning of the 19th century. Ahmadu Bello raised the bar of political consciousness and participation when, in 1944, he engineered the establishment of the Northern People's Congress (NPC) as the first political party in northern Nigeria and the rallying point for politicians in the region before independence. History will not forget Ahmadu Bello for his charisma and political sagacity, which provided easy passage for his kinsmen to assume political and administrative positions in Nigeria's post-independence era. The distinguished elder statesman and Sardauna of Sokoto has his face on his country country's 200 naira currency as a mark of honor to one of the architects of Nigeria's independence. Western Spring Television identifies Ahmadu Bello as a watershed character in history. Born Jeremiah Oyeni Obafemi on March 6, 1905, Obafemi Awolowo was a prime architect of Nigeria's independence and most consummate advocate of free education and social welfare in Africa's most populous nation. Erudite politician, thinker, and philosopher, Awo was fondly addressed by associates and political colleagues, brought his unique attributes to bear on governance in the defunct Western region. He administered as leader of government business and the premier between 1955 and 1958. Obafemi Awolowo's premiership witnessed pioneering in multi-sectoral policy initiatives and execution. The Western region under his administration paraded several enviable records. First television station in Africa, first real estate in Nigeria, first high-rise building in Nigeria, first modern sports stadium in Nigeria, first agricultural settlement in Nigeria, first modern civil service secretariat in Nigeria, and first industrial estate in Nigeria. His face is on 100 naira denomination as a mark of honor for his distinguished services to his country. Western Spring Television identifies Obafemi Awolowo as a major character in history.
Welcome back to Spring Clinic. My guest is Professor Peter OLAITAN, a professor of bones and plastic surgery, and also the Chief Medical Director, Uni Osun Teaching Hospital here in the city of Osogbo. I will be interrogating issues around bones and plastic surgery. Sir, you're welcome back.
Thank you.
Do you have a platform for sensitizing people around the issues that we have raised today, that in case you suffer burns, because accidents do happen, emergencies do happen, if people are skilled with the knowledge and the right information, they will know what to do. Is that a platform to sensitize the people?
Yeah, we do. We have the Nigeria Burn Injury Society, and I was a president of the organization until recently. And that organization actually involved plastic surgeons, plastic nurses, and indeed patients, and anybody can actually join once you are interested in creating awareness about burns and burn prevention, essentially. So that we're going to be meeting in Lagos in the next 2 months by August. What we do every year is that November is a period when we sensitize people on burn injury, and that happens around the country. We've used your station here, the RAVE radio station. We usually do annually to do that. And we go to schools, we go to marketplaces to sensitize them and distribute pamphlets how to prevent burn. And that organization also has produced a book on first aid treatment of burns, preventing, educating people about the fact that certain things should never be added to burns, and condemning that, and training or educating on what to do when anybody sustains burn injury.
Do you train first responders? Because at the first line of contact, if there's burns, do you have them around? People perhaps within the primary healthcare system who are the first responder to incidences of burn? Unfortunately,
we don't. I mean, so we expect that every, and that's maybe the error, we expect that every health worker should be able to take care of burns, to take care of at least the small part of the burn. Sometimes you get to a center and they see the extent of the injury, say, no, you can't stay here. In fact, they don't allow you to stay, they just say, go straight to the burn injury. So it's also part of the awareness and knowledge about the fact that, look, we can't take care of you here. We don't have any facility or knowledge of taking care of you here, so go to the street. But so it's always important for people, if you sustain burn, to go to hospital. By hospital, I say hospital manned by health workers who should know where to direct people to. Okay, whether private hospital, a private hospital practitioner should be able to say, no, I can't handle this. This is beyond me. This is not my area of specialization. Go to centers where you can be properly taken care of, because the place where you take care of burn injury is not like the place where you take care of other things. We usually create an environment for them where the traffic flow will be minimal, and therefore rate of infection will also be reduced. But if you throw them into the same world where you keep all sort of patients, then the risk of infection is quite high. So we expect every health worker to be able to do this.
Can we say the issue of burn is a serious problem in Nigeria?
Yeah, it is. All over the world, you find out that burn, the most common source of burn injury is scald, hot water, hot tea, hot food. Okay, but in Nigeria, the most common is fire.
Okay.
And so it's
when houses go up in flames.
Houses in flame, domestic accident, electrical issues, generator issue, kerosene, stove, and all that. So those tend to cause a lot of burn injury. And one other thing that we have also noticed is that the extent of injury in Nigeria is also higher than what you see outside the country. So when you go outside and you see people presenting 5%, 10% burn injury, you say, and they think that's major. Here, you have people coming with 100%, the entire body burns.
Wow.
And especially when you have burn disasters, one of the major problems, which to the glory of God now is not common, is people when either a tanker falls and people go and scoop food, petrol, okay, or pipeline vandalization, and they start scooping. I mean, there was one that happened several years ago in the Delta State, and hundreds of people were burned to ashes at the point. Because you just need a little spark, and the entire environment will. So we have, when you talk about the extent of the injury, it's actually much more in this part of the world than in developing countries. So, and flame is a major source of burn injury. Of course, again, burns from chemical assault is also very common in our environment, especially in the East. Not so common in this part, in the Western country, part of the
people
country.
Are seeking revenge, emotional betrayals, and everything like that. And can we safely say that 4th degree burn is what attracts plastic surgery? No,
plastic surgery should be involved from 2nd degree burns upwards.
Okay, not the first.
Not the first.
Okay.
Because it also, again,
the plastic surgery is the remedy of what burns have caused.
That is the truth. When we talk about plastic surgery being involved, it's not necessarily doing some cosmetic procedure. It is about restoring the function and the physiology of that part of the body. Okay, so and it takes the plastic surgeon or burn surgeon generally, because it's not all the burn surgeons that are plastic surgeons. There are people who just go and take take some training in burn care, and they become burn care surgeon. So we need an expert to restore that destruction functionally and physiologically, physically and physiologically. Okay, so and the burn care expert, whether either nurse or doctor, will be able to do that.
Why is it difficult to restore the exact skin color after injury or burn?
Yeah, okay. I mean, like I said, Yorubas know, you know, and this is to buy also when something.
I'm just wondering, with the advancement in technology, medical technology.
Let's look at it this way: the skin is removed, and then this what is there is not going to be reepithelializing. It's not going to replace the. Regenerate. Okay, so you can't regenerate once you get to the 3rd degree, 4th degree burn. You can't have regeneration except you bring another skin to cover that place. So if that is going to heal, it's going to heal by what we call fibrosis, fibrous tissue, scar tissue. That's what and scar tissue don't look like normal skin. So it's scar that you produce, unless you then cover with skin taken from another part of the body.
I want to know, burns, is it different in ages? Kids, adult, teens. For instance, if I suffer burns now, the likelihood of regeneration or total healing Can you compare to somebody who is in his 10s or somebody who is between 10 and 10?
Yeah, for extreme of years, we talk about usually especially the very old. The very old tend to do worse than those who are young. But generally, injury response to injury, burn injury, wound care, wound healing, it is not different from a child to an adult. But in old age, because of other complications, somebody is diabetic, so that diabetic mellitus on its own will impair the healing. Or somebody else is carrying other things, other medical issues that may impair the healing. Otherwise, it should be able to heal the same way. But at old age, because of also associated things, morbidity, it could be worse.
Okay. In Osun State, I know you are the Universal Teaching Hospital, but do we have experts across board? From the primary to secondary, and I know the tertiary, we have you and a couple of others I want to guess. Do we have the facility and the personnel to care for bone?
As far as personnel is concerned, the only place where we have personnel are the 2 teaching hospitals in Osun State, our own teaching hospital and IFE. Okay, but talking about primary, secondary care, as of today, we do not have. Okay, and then we also have a burn unit in the teaching hospital here in Osogbo, which has been there for close to 20 years now, and we also have one in Ife. And that is a specialized environment that is created for the care of burn patients. And the good thing about this is that because you also have experts, the nurses, the doctors are there, they are experts, and that's what they do daily. So it's easier for them to know, if this is going to be complicated, they can tell what will happen. So that's why I said the experience is better. So what you do every day, you're likely going to do it better than somebody who just does one in a while. So that's why we say it's better to just refer to those centers where those experts are.
There was a time I was privileged to attend a seminar on emergency and how to respond to emergency situations. And the doctor or the expert that came to speak said, most often, responders who are just passers-by, good Samaritans, they complicate cases of victims more often than not. In the case of burns emergency, how should we handle even the rescuing of the person before first aid is even applied? What should we do that will not complicate, aggravate, or even worsen the case of the victim that we intend genuinely, innocently to assist?
Well, I think the first thing is, what do you do just for yourself when there is fire in the accident? Somebody said there are 3 things you must do when you are at home and there is fire. Get out, and get out.
Wow.
So by all means, don't think about your certificate, don't think about the property, just get out. I had a patient whose wife and children were in the house and there was fire. So he went out, and then in the process of rescuing the family, he got 100% burned.
Wow.
So everybody died. Okay, so the first thing is to be sure that where you are going to rescue somebody is safe. Okay, get water, get fire extinguisher, get fire people to make sure that the path you are going to go through is clear and secure
to some extent.
And safe. Okay, so don't just dabble and go into a fire in order to rescue something. It's bad enough to lose a loved one.
I know.
But then it's either
it's not complicated for you to die too.
So that too.
It increases the
fatality. So the first thing is that, are you sure where you are going? Of course, something like that happens. People thinking is distorted. But the major thing is that somebody is there. Please get the path clear of fire, of anything that will also trap you. Okay, that's important. And then of course, once you get that fellow out, then water, like we said. And if it's an electrical burn, then get that fellow with an insulator, wood, dry wood, to get him off the electrical source, and then you can then use your water. Chemical burn, somebody has chemical burn, water again. Okay, is the solution to that. So I think once you do that and then you wrap the person up, you can take to the nearest hospital.
Okay. I want to also speak about children. Most often they are very curious. They are very innocent. They walk up to where the stove is, where the gas is, and in the process, they can cause burns to themselves.
Yeah.
How, number one, you are not an expert in how to prevent them getting there. That's not within your forte. It is when the issues occur that you come into the scene. So what should be the immediate reaction of a father or a mother whose child has just suffered burn?
Well, I think the first thing is to make the home safe. Okay, And then, so if you are going to have a table, let the table be a little high. Don't put food at the tip of the table. A toddler will come and pull the table mat and then draw the hot soup on himself. Or we're going to fix an electrical socket. It shouldn't be at the reach of a child.
It should be
Get it a little high so that the child doesn't go there and be pulling and putting his teeth on
or anything or dip anything in it.
And don't cook on the floor. Okay, on the surface. Now, and then when you are boiling water to bath, okay, baby, and we've seen a lot of that accident happen. You are carrying the water in a kettle and the baby just rushes to you and it pours. So we say take the cold to the hot. So take cold water from...
Take the cold to the hot. That's right.
Don't take the hot to the cold.
Make sure the hot is static.
Yes.
But the hot is what cold is moving.
Get the cold water in a bucket, take it to the kitchen, pour before you start moving it.
That's right.
So if those simple things will prevent accident to the children. We've also found out that scald injury, hot water, hot tea, hot soup are the commonest cause of burn in children, whereas fire is the commonest in adults. Okay, so if we can prevent those little things, occasionally the children take wire and chew. Okay, so don't put cable where the children can just grab and they innocently chew the cables. So if we are able to do that, we prevent almost 80 to 90% of the burn among children. Now, when this now happens, what do? Same thing. Get the child off the electrical source, get the child off the fire, and then pour water, and then take it to the hospital.
Do we do this during the antenatal and postnatal?
No, unfortunately, no, we don't do this.
We should do that. What do you think?
I agree with you. I mean, it's again, maybe it's not common.
That's right.
So what is not common is usually not emphasized at such meetings. Okay, so maybe you have all sorts of things happening to children, but maybe you have like 2-3 of them suffering burns in a year coming to the hospital. So I think it's the reality that makes people not to talk often about it. But there are so many things to talk about.
I know.
When you go to antenatal care, so they rather be concerned with those things that has to do with pregnancy, delivery, and all that, and family planning, rather than talking about burns. But what the Nigerian Burn Injury Society has been doing is to sensitize people on a recurrent basis, especially in November every year.
It will cost a fortune to treat burns.
Oh my, burn is expensive to care for. And that's the truth. Very expensive. And it causes a personal, we describe it as a personal calamity, family calamity, and community calamity. It's a lot to treat burn injury. I mean, somebody was just admitted in our hospital, and within 3 weeks, and the father told me, he said, I spent about 1.5 million. Okay, and if you are looking at skin substitute alone for a 20% burn injury can cost up to 8-10 million.
And that's why it's important that we preach prevention.
So, and that's why we must do prevention. Prevention is always cheaper than cure. Burn injury is a disaster, and we should prevent it.
Prof, I want to thank you for coming on the program.
My pleasure, sir.
It's a pleasure to have you at Spring Clinic.
Thank you so much.
Viewers, my guest has been Professor Peter OLAITAN, a professor of bones and plastic surgery, and of course, the Chief Medical Director, Uniosun Teaching Hospital. We've been treating issues around bones and plastic surgery on Spring Clinic, on Western Spring Television, your favorite television station. I remain yours sincerely, standing in for the regular host, FEMI ADEFILA. Till next week, when we come here with another edition at Spring Clinic. Bye for now.